Hello, my name is Dr. Marcus Smith, and I'm the owner and veterinarian at Chattahoochee Animal Clinic. And today I'm going to talk to you about canine osteoarthritis. It's also known as degenerative joint disease. It is a disease that affects your dog's joints. A healthy joint consists of cartilage. That cartilage covers and protects the ends of the bones. Cartilage has minimal nerves, and so when it touches each other, it doesn't hurt. However, in osteoarthritis, the causes are that the cartilage tends to wear away, and then it exposes the bone. The bone has many nerves, so when the bones touch, then your dog feels some pain. This pain can greatly affect your dog's quality of life and also can shorten their life as a result. So what are the risk factors? Osteoarthritis can affect any breed of dog, but it is very common in your older dogs, your giant dogs, your large giant dogs can have it at an early age. It can also be breed inherited, such as hip dysplasia. High levels of activity for a long period of time can also predispose that joint. So what are the signs? Well, sluggishness, unwillingness to jump up and down, low activity, running, jumping, reluctance to do any of those kind of things, that can be the first signs. But it can also be reluctance to want to eat, reluctance to want to extend the hips or hip joint. It can also be aggression or withdrawalness of the pet itself because it's afraid to hurt. So what can we do? Well, there's a lot of different things, but it starts first with a physical exam at your veterinarian. At a physical exam, I will look at the joints, I will feel all the joints, range of motion exercises, and then I will look for lamenesses when they walk. It's called a gait assessment. Okay, and then after that, once we pinpoint where our problem area is, we want to take x-rays. We want to look for degenerative changes in the joint. Okay, so how can we help these joints once we establish we have a limping dog? Once we establish that we have radiographical changes consistent with arthritis? Well, that's when we deal with this type of treatment, these things. And I'm sure a lot of you have heard of them. Medicam, Rimadyl, Daramax. These are all your non-steroidal anti-inflammatories, okay? These are your pharmaceuticals. Then you move into the nutraceuticals, which can help, won't hurt. Okay, so your joint supports, glucosamines. There's newer products out there such as the Tricox that we carry and Idsa by VetraScience. Those work on the inflammatory aspect of the joint disease, but also provide good joint health. So, what other things can we do? Well, first, we want to have a lean dog. It is very important to have that lean dog to lose the weight. The less we have weighing in on those joints, the better those joints can work, the less stress that they're predisposed to. We want to minimize stair climbing in the early stages because, well, that just keeps the activity keeps the inflammation going. Okay, so what else can we do? Well, there's a lot of different things. So when we get past the weight loss, then we have to work on the joint. And that's accomplished with antioxidant therapy, that is accomplished with omega-3s, that is accomplished with glucosamine chondroitin supplements, and then as we need to, giving non-steroidal anti-inflammatories to help really bang out some of that inflammation. However, we want to make sure that the liver and the kidneys are okay to handle this type of drug. The anti-inflammatories can cause kidney failure if they already have kidney disease. It can also cause gastrointestinal ulcers if they're on any particular other medications, such as steroids like prednisone, prednisolone, triamcinolone, Temerol P, those kind of things. So we have to be very careful with what we do when we give these drugs. That's why I say they're not risk-free. These are a big bonus and will only help. Okay? So what protocol do we have here at Chattahoochee Animal Clinic? Well, when we see a pup that comes in for limping, there's a few things that we're going to do. We're going to assess them, like I said, we're going to do x-rays. We need to take out that joint inflammation immediately. We accomplish that by using these. However, we try not to make this a lifelong therapy. This is more, I say we treat it like we treat Advil in us. We pulse treat it. We give it for several days, provided they can have it, and then we stop it, but we continue with this stuff. This is your maintain, this is your maintenance, this is where you want to be. This good stuff here prevents us from having used the stuff here that creates side effects. So these are all safe things given and administered correctly. So our goal is we take down the inflammation immediately with something like Daramax, something like Rimadyl, Medicam. but we're maintaining the joint on tricots or joint support. We also have ChondroProtect, which is adequate. Adequate works on that cartilage. It helps promote joint health. So these are things that we want to work on the inflammation in the joint. We want to promote joint health. We want to scavenge all those toxic things that are in the joint that can create progression of osteoarthritis. So that's where this comes in. And then occasionally, just like us, we're going to need to get some help. We're going to need to reach for that bottle of, for us, Advil. Never give your dog Advil. For these guys, we're going to reach for the Rimadyls, the Deramaxes, to help them out. Big day at the park, family over, they're going to be sore. They can go on this for a few days, but again, our mainstay we want for chronic therapy is the Adequins, the NSAIDs, the joint supports, the Tricox. Very important. So the take-home message here is, one, always see your veterinarian if you're worried about having those kind of issues, if we're worried about osteoarthritis. Two, get the weight off. It can add years. And some people say 2 years. There's studies out there, 2 years of added life by just dropping weight. Thirdly, we're going to look at seeing how we can create a good healthy joint for the long term. That's with these products, the nutraceuticals. And then lastly, for those periods of inflammation, for those flare-ups, we have anti-inflammatories to use in them. Okay, I hope this is helpful. If you have any questions, you can always give us a call, 770-993-6329, or check us out on the web at myatlantavets.com. I hope everybody has a great, happy, healthy puppy. And again, if you have questions, we're here for you. Thank you.